Okay, Mac, let's
Okay,
teach
Pam.
people a little bit about how do we know if I have a TMJ problem?
How do you know? Okay, so TMJ, temporal mandibular joint. So you have your joint right here, but you also have muscles. So if this hurts, it doesn't work right, which you're going to demonstrate for the people. If it doesn't work right, you've got TMJ. And if your muscles hurt, especially these muscles you chew with, you over chew them, muscles up here, muscles down here, you push on it, it hurts. Guess what? You've got TMD, TMJ. They're interchangeable names.
Yeah, so also like what about some people who don't even just always feel the issues here? Like they don't get the lock jaw because, we've treated patients for a million years, it feels like, right? But
Right,
they don't always have the clicking, popping, pain, unlocking, right? That sounds like a
right,
dance, but it's not fun.
right, right,
But they come in with different things like headaches or eye issues, right? Where the eyes are causing them to have pain behind their eyes or like almost like a shaking side to side. What about the ear stuff like vertigo, dizzy spells, someone stabbing me in my ears, um, extremities, lower extremities, like my fingertips
right,
tingle. How about
right.
forehead posture? It's not just from
Like
being
which
on
I have,
computers all the time. Huh?
which I have. You told me about that about 10 years ago, but I need to get it straightened out.
It's cute on you, but thank God you don't suffer. But most of us do have forward head posture, but sometimes it's related to our joint issues, right?
Yeah, and you mentioned a lot of different feelings and symptoms. Okay, let's talk about a big nerve. It's called trigeminal nerve. It's like a big five that comes across your face. And everything that you mentioned, that pain is coming or that feeling is coming from the trigeminal nerve. So it's just huge. What happens when you pinch a nerve? You're going to have a response.
Right.
So if you get a nerve, if you get that trigeminal nerve pinched, you really don't know where that symptom's going to.
Pause. To the lay people, pinch is another way of saying pinched.
Pinched. Oh, yes. Well, you being from the Northeast and I'm being from South Texas, we do have some different things and different ways.
No offense to my Southern folks. I love you all, but he's a dear colleague and friend, and we've known each other for years, so we can tease each other like that.
That's right. That's right.
I'm sorry,
So,
pinched nerve.
okay. Now, you mentioned about non-painful TMJ conditions. So I would like for you, since you're a lot prettier than I am, for you to demonstrate what happens on the deviations that they can be non-painful, but is it a serious situation? Look at that.
So that's
Okay,
not normal, right? We know that's not normal. The mouth should open and close nice and straight.
that's correct.
And you want about 40 millimeters between the edge of your upper teeth and lower teeth. So 40 millimeters is roughly like three fingers stacked like this.
Correct.
Okay, minimal for opening. So if you can only open this big, that's not normal. And sometimes people get worried because when they open super big, they see the joint kind of come out like mine will. Watch.
Mm, yes.
But that's normal. It's when one side pops out before the other, or it does like a weird, like, like a, what is it? Like a whiplash, like a whip around. That's abnormal. And you know what? You brought a really good point about asymptotic TMD issues. I was like, okay, let me clarify because people don't know what TMD is. Everybody calls it TMJ, right?
Right.
Well, TMJ, not to nerd out, but I want you all to learn this stuff. TMJ is the acronym for the name of the joint, temporomandibular joint. But when you have issues, whether they're painful, meaning symptomatic, or they're quiet, but we see signs like the deviation, like we're talking about, um, that's called temporomandibular dysfunction. Okay, so we call it TMD or TMJD. So not to confuse things. But another sign of it, Mac, to go back to what you're saying, is that people will have very ground down, worn teeth and never complain of headaches. It's like their teeth were stronger or their teeth were weaker than their muscles. So the muscles ground them down without any of the issues we talked about, right? And then, like, sometimes it was the opposite. It's like the teeth were super strong, they can't get ground down, but they have all these pain issues. And that's when they constantly go undiagnosed.
I want to go back to when you opened and closed your mouth and the deviation that one
Mhm.
goes to one side. So if you have a deviated jaw on opening, guess what? You have TMJ. There's no
That's
buts about
exactly
it.
right.
No buts about it. So the question is, you have a clicking joint, and every dentist is different on this. You have a clicking joint. Does that mean that you're going to have a horrible situation later on in life? No one knows. No one
Yeah,
knows. Yeah. But should the patient know that it's not right?
correct.
Yes.
You know, Mac, the way we always try to explain it to people, patients that come in our office, is people for some reason understand hips, but they don't understand the joint here. So I always tell people, imagine that when you were a little baby, that you were born with one leg like an inch shorter than the other. Well, most people wouldn't even notice that. You're totally fine. And baby Mac learned how to run, walk, and jump, right? And so it goes undiagnosed still. And nobody complains. Not you're not complaining of pain with as a little kid. But then let's fast forward till your 20s, 30s, or 40s. Depends on how tolerant you are towards pain and dysfunction, right? Because everybody's different. Some people complain about everything, some people, it takes a lot, right? But you start thinking, wow, my hips are a little bit uncomfortable, or my knee, or my back, because you've been constantly, you know, trying to accommodate for this short leg issue, right? But you chalk it up to dumb things we did when we're little, or we're kids. You keep ignoring, you keep accommodating it. And then you're now in your 40s, 50s, or 60s. And it's kind of too late. All those years of accommodation needs you to have joint replacement, hip surgery, knee surgery. Now, let's take the kind of a different approach. And let's say someone saw baby Mac and saw him as an infant and saw that his legs were different lengths. Now, we can't grow legs, right? But when you started walking, if a doctor took precise measurements to put an orthotic in your shoe, when your shoes are on, your hips are level, right?
Right.
Okay, perfect. But what happens as soon as you take the shoe out? You go back to that dysfunction accommodation. But when the orthotic, when the bite or when the legs are level, you function better. And, did they cure the problem? Not really. But teeth are different. We can make orthotics, which we'll talk to in later podcasts, like where to start, how do I get help? But we can also later move teeth into the right position so the TMJ and the muscles that work the joint will start functioning correctly. And then people stop grinding, they stop deviating, they stop locking, and all the other stuff, right?
Correct. And I'm going to point out one thing because we're going to talk about all this stuff. We're going to open up. We're going to open up all about all things TMD and TMJ. But you mentioned this is how marvelous the human body is. You mentioned the tingling of the hands. How in the world could tingling of the happen because of your teeth? Okay, if your teeth are not fitting right, which you've been talking about, one leg shorter than the other, then that creates disharmony, and disharmony creates overworking of the muscles. So there's muscles in the neck called the scalene muscles. Name doesn't matter. But there's a bundle of nerves that run through those scalene muscles. And if they go in spasm, then they pinch that nerve. And we've already discussed what happens when you pinch a nerve. So then that's thoracic outlet syndrome. It's all created by the teeth not fitting, muscles going into spasm, pinching nerves, going down to the top of the hand. I mean, that's just unbelievable. So these are the things that are really fascinating to learn. And you really must learn about your TMD, TMJ symptoms. But so let's go back to the original question of, do I have TMD? So I'm a patient. I'm coming to you. I'm seeing you. I'm saying, Pam, how do you start doing your diagnose? I know you first start with the history, but then do you start palpating the nerves? Do you start palpating the muscles? Do you palpate the
Palpating
joint?
meaning touching, right? Just so people
Touching,
know. Uh-huh.
touch. You got to
Feeling.
touch. You can't diagnose TMJ, TMD without touching.
Correct.
So people can touch themselves. People listen to this podcast, they can put their finger right in front of the ear and push. Does that hurt? more than likely you got TMJ. Feel your temples, feel a knot, push on that knot. Does it hurt? More than likely you have
Right.
TMJ.
Well,
But as a doctor,
let me
that's what
back
you,
up 1 second because I want to clarify. Usually, if you touch the joint here, that you typically don't have a lot of pain, believe it or not, because unless the disc that lets the joint work, unless it's pinched in a certain way, we don't get pain in the joint there, which is very misleading to people. You can feel the dysfunction like we discussed already, but it's not always painful. So just because you don't have pain when you touch this joint, that doesn't mean anything. I want you guys to also look in our show notes because we will put a link out to exactly all the different signs and symptoms that encompass TMD because there are so many. But I feel like I interrupted you, Mac, and let me have you go
no,
back.
you didn't.
Okay.
No,
So, but the thing is, I want it very clear to our listeners that TMD can be misunderstood for different things. So it is imperative that we rule out scary things like cancers, or if it's eye issues, well, when's the last time they had an eye exam? If it's vertigo issues, when's the last time an ear, nose, and throat doctor looked at them? So there's other things that is really important to rule out. But you know as well as I do, when you were treating patients, we're usually like what? The sixth, eighth, or 10th doctor they've seen. And these poor people come in thinking they're crazy. They're so sad. They're in pain. We call it pain face, right? Because they just can barely open their eyes, some of them, because they suffer so badly. But they've usually gone through the checklist and everyone's like, there's nothing wrong with you. They're on neurologic medications, they're on antidepressants, just a litany of different medications where it comes down to us, to correctly diagnose the problem and see if it's an unbalanced bite that is causing all of these symptoms to come to surface, right? The
right.
unbalanced hip, the unbalanced bite, we're going to suffer. So in my office, like you say, we palpate muscles, we feel everything, but we also get really different scientific. We also take a 3D scan of the head. It's like literally a minute. It takes a minute long. It's not like you have to sit into some kind of MRI machine, but it lets us look at the joint shape and how it fits into the skull. Um, there is like the radiation in it is extremely low dose in our practices because of the type of machine we invested in. It's literally you can spend 2 hours in the park or have an image done. That's the equivalent. Aside from that, you and I both, when we treat TMD, we look at muscles. So we put little stickies on the face so that we can see how much activity is going on. Are the muscles in spasm? And then we also, like track the jaw and see how it's actually functioning, all computerized, because correct diagnosis is all about making sure we diagnose correctly. I mean, we're sitting here talking to you guys to make it simplify at home. Like, okay, what things can I start looking for at home for myself? But when you come into our office, we better darn be an expert at it and have the right kind of equipment and training to know how to diagnose correctly, right?
That's right. And so these people who have been to 5 or 6 other healthcare professionals, including dentists who are unaware of TMD, then they need, I lost my thought. Okay.
Well, a lot of them don't know, Mac.
Well, I
And
mean, okay, yeah, they don't know the TMD. Let's restart. Okay. So why are people so unaware of TMD and even ask, why do I have TMD? They should really know because TMD is not taught in dental school. It is not taught in medical school.
correct.
Dentists don't talk to doctors. Doctors don't talk to dentists. These poor people that were trying, all of you out there that are listening to this, more likely you have TMD or you have a loved one that has TMD. We want you to know what's going on. We want you to be educated. We want you to be able to find the right healthcare professional for you. And I'm going to be very adamant about this throughout the whole series is that dentistry is the profession that owns TMD, not the neurologist, not the NTs, not the chiropractors, not the massage therapists. It's us.
You know, nobody
But
wants to really hear that though, but it's true.
but it's an educated us, you know. So you don't see a patient that you know has TMD with the bite not being correct. You don't send them to a neurologist. You don't send them to an ENT. You don't send them to a massage therapist until after you've tried to get their bite in harmony.
Right.
So if a person has a horrible toothache, they don't call an ENT. They don't call MD. Who do they call? They call a dentist.
A
So
well-trained dentist, because
so
like you said, in dental school, we are not trained on this. This, God knows how much education we took, countless hours, and invested in our
so
teams and ourselves.
and as I say in the new book I'm writing, in dental school, we were taught to do and not to think. And what we want to do is get the lay public to start thinking and start saying, hey, doctor, I'm paying you. I don't care what doctor it is. I'm paying you. You're working for me. And I have the right to ask questions. I have the right to know what's going on with myself. And if you don't know, please send to me somebody that does know.
Yep. You know, like you guys must have heard in our intro, me, like Mac is now in retirement. He's been treating patients for over 50 years, and he is doing this with me because we just see so many people as a last resort ditch effort. And it comes from, like I said, people that don't always hurt, but they're destroying their teeth. But then people that are borderline suicidal,
Right.
we see this every day. And if we can give you guys insight, like what Mac is saying, to kind of do it yourself evaluation, so that you can also prep yourself better when you go in for a consultation with a dentist that specializes in TMJ or has the training. You know the questions to ask, and you kind of know what to look for. You want to make sure they're doing CBCTs. You want to make sure they're doing, EMGs. You want to make sure they're taking the time to touch and feel, and it's not done over a FaceTime consultation. That's not going to work. Okay. So that's our goal with it. And for those of you guys who don't know, Mac is a published author, and in his book, he has this beautifully simple book that talks about like it's called the life robbing pain of TMJ. Did I say that right?
The life robbing pain of TMD. Why me?
Why me? Yeah, and that's so true. Why anybody? But it really helps go over the things that we just talked about. It's got diagrams. It's beautifully illustrated. You can find it on Amazon. We'll have it in our link. We'll put it in our notes and link it to Amazon for you. But this was our very first podcast, and we are super excited. Do you want to do a quick wrap up, Mac, about
Yeah,
like
but
going over symptoms, or
I
we've
want
got
you
them
to
already?
I want you to tell me the why of you writing the book that you wrote about these children in the craniofacial development.
Well, after treating adults for over 20 years, quite a long time ago, to me, it's a massive passion project to help recognize things in our infants, toddlers, children, and adults, because so much of this can be avoided or negated. It's all about proper tongue placement, craniofacial, meaning facial development that affects how we sleep, our posture, all of the above. We're connected head to toe. And in each podcast, we will get clinical and we'll teach about things that how we treat, and when and why through the different ages, right? What to look for and how to take care of it. But we also do want to get a little bit like into, again, because people are always like, why didn't anyone tell me this? Why, after like all this money, all this time, all this fear and pain, why doesn't anyone know this? That's why we're both doing this, Mac. It's just not for
Right.
me. I treat children too, which is why you're bringing it up. But I got tired of seeing adult faces that were already ruined. I mean, there's still hope, and we treat that well, but if we can just catch it in the younger ages and get people looking at people differently, let's open up how we look at our patients, doctors. Let's open up this discussion so we can correctly diagnose and offer people real treatment options that will work.
Yes, and any parent, grandparent, guardian of young children should understand what Pam's talking about with her book. It's not that difficult at all to see in your children. Once you see it, you can't unsee it. And
So
Pam,
true.
what's the name? What's the name of your book that's on Amazon all over the
It's
world?
called Craniofacial Development from Infancy to Adult. We'll put it in the show notes, but I promise you, it again, it's one of those quick, simple reads. It's meant for just the lay people that are searching, and don't understand what's going on. But it breaks it down by different ages. We give it to all pregnant mothers in our practice. But it just guides you like, okay, my infant should not be open mouth breathing at night. That's not cute. There's something wrong. And it's not meant to be alarming. It's meant to say, why are we overlooking this? Why is a human being breathing through their mouth when we're supposed to breathe through our nose? We're obligate nasal breathers. So we'll break it down podcast by podcast for sure.
So since we're opening up,
Uh-huh.
since we're winding down on this podcast, how about the next podcast be something like dentistry and medicine has failed the public? Because nobody knows this.
Dentistry does what? Say it again.
Dentistry and medicine has failed the public.
Ooh, that's gonna be spicy.
Let's do that next time.
I
Agree?
like it, Mac. Let's do it.
All right.
All right. We'll see you on our second podcast.
All right.